And go live.
Yeah.
So, hello, good afternoon, everyone. I am Dr. Sudeep, consultant pediatric cardiologist working at KIMS, Cuddles, Secunderabad, as well as for Kondapur. Today, it's a very important topic. That is, this problem is there since last 3 to 400 years, and now it's still very prevalent in a country like India and all other developing countries, particularly Southeast Asia and African nation. This is like a rheumatic heart disease. The topic is valve heart disease awareness. But the most common association or most common cause of heart valve problem in children in developing countries like India or is rheumatic heart disease. Rheumatic heart disease is a condition where it starts with a normal infection, but it starts developing, affecting the heart, and because of it, the wall leakage or the wall block will start. So this is the most common cause for the acquired. That means because of the infection or because of the environmental cause it causes. Second is the heart wall awareness. You to see there are few diseases, heart wall problem which is present from birth. That is known as congenital heart disease. Congenital is from birth, heart disease which is present from birth. So one of the most common, which is present in 2% of the population overall, is the bicuspid aortic wall. Normal wall is three leaflet. If you see the wall is wall which is connected from the heart chamber and supplying the body tube. There's got the three leaf, but because of the three leaf, the two leaf got fused. So that is causing the bicuspid aortic wall. So normally 2% of the population will have bicuspid aortic wall, but only out of 2% of the bicuspid aortic, only 20% will develop the heart block or heart leak. So once the heart block or heart leak, what are the implications that we'll discuss today? So that is in category one most common, which we call it as a congenital heart disease, is the most common heart wall problem with congenital heart disease. Or second most common in the acquired, that means which got infect, which is not present since birth and which later got developed with relation to the environment and the poor socioeconomic area, is a rheumatic heart disease. So now we'll discuss one by one rheumatic heart disease as well as the congenital heart disease, bicuspid aortic wall, most common, but others are also there. So first we'll go with the congenital heart disease. So congenital heart disease, I told you that in normal heart there are four chambers. The left side chamber will supply the body, takes the blood to the body, and from that chamber one tube arises that is known as aorta. And in between tube and chamber there is a wall that is known as aortic wall. So sometimes where the three leaflet, it's a three doors on that wall, but sometimes two door got fused. So because of that, wall movement got restricted, so that is causing the block. Normally, I told you 2% of the population will have bicuspid aortic wall, but once it becomes blockage of the flow, only up to some blockage is not at all a problem, but once it goes beyond 50 to 60% of the blockage, that means it is causing affecting the flow of the heart and it will affect the blood pressure, and if it not treated properly it will cause the heart dysfunction and the death also of the patient. So how to detect that? So normally bicuspid aortic wall is normally present, but once you are having the symptoms, what are the symptoms? Like breathing problem in bigger child, in bigger grown up child there is a chest pain, and when the child is getting the activity, doing activities, getting the chest pain as well as the breathing problem, these are the two or three common symptoms for that. So but because these problems can present but without knowing for the long time, so any child with any family history of heart disease, or when they have these symptoms like chest pain, breathing problem, or when during normal your pediatrician you found out some murmur or some extra sound on stethoscope, these are the places where the pediatrician will send to the pediatric cardiologist like us for the review, for the assessment of the baby to rule out any cardiac heart problem or cardiac heart problem is there. Sometimes this is incidentally detected, but once we follow up, we found out the block is increasing or leak is increasing, that requires the treatment. So once the block is significant, what is the treatment? So treatment is very simple. Sometimes when there's a block is there but there is no leak, so with the vein from the leg vein, we are taking the balloon and we are trying to open the wall so that the wall block will disappear. But when the already leak is there, then it's a danger. Then in that case, you need the open heart surgery. Or even after balloon, if we cause the balloon dilatation, or remove the block, but there is a severe leak, in that case also you need to go the open heart surgery. So this is the condition which is known as aortic wall problem. Apart from that, there are some other wall problem like mitral wall prolapse. There is some congenital heart problem where the mitral wall, normally it's a light tight. This is the wall which is also present on the left side between upper and lower chamber, and that is allowing the blood from the upper to lower chamber. Normally the valve is tight, but once it's a loose, it will not co-opt, it will not meet each other. There is a in the heart leak in the heart, so that is causing the leak, or sometimes that will causing the chest pain. So that is known as the mitral valve prolapse or mitral regurgitation. And once this is there, then you want to also, once it's a mild to moderate, no need to do anything. But once the symptoms started, as I told you, chest pain, dyspnea, not growing well, recurrent cough cold, then you have to see the wall. And when the wall leak is significant, that needs the surgery. So these are the two most common. Or the third, which is the congenital, is on the right side, that is known as Epstein's anomaly. Epstein's anomaly is there when the mother sometimes goes on the psychotic treatment, they took some lithium medicine or some, that is causing the child to develop the problem that is known as Epstein's anomaly, which is on the right side. And Epstein's anomaly either has two ways: either they present very early in the neonatal age, which when it present, it's a very dangerous and you need early urgent surgery, and you have to treat early, and the but outcome even after that is not very good. But if you do properly, the outcome may have very good in terms of morbidity and mortality. If it not present in the neonatal age, or in fact it may present later at the age of 10 to 20 years, after 5 to 8 years, the symptoms are same. The heartbeat will be fast. When the child appreciate there is a fast heartbeat, or mother appreciate there is a increased heartbeat on the chest. So then, and with the same complaint like breathing problem and not walking, there is a fast heartbeat. Once you see these two things, then you'll able to see, take that echo. The echo is the main diagnostic feature with all congenital heart disease, where with the echocardiography is the ultrasound of the heart, where we're able to see all the four walls and see what is the problem in the heart. In the same way, there's a block on the right side tube and heart connection also, that is a pulmonary stenosis. That also if present, that will cause the heart dysfunction, dyspnea, and it causes the blue color also sometimes. So these are the things. But if you see the congenital heart disease, which is disease present from the word and the wall involvement, once you see this and diagnose with the echocardiography USG of the heart, these are the treatable conditions. With the balloon or without surgery, by the vein, we are putting the balloon and opening the block wall, or when the valve is leaking, by doing the surgery, you can able to give a very good life to the child. So remember, whenever anyone suspected any heart disease in the form of either without either with the symptoms, when there is chest pain, dyspnea, recurrent RTI, recurrent respiratory tract infection, recurrent pneumonia, or when the mother find out heartbeat very fast, and when there is no symptoms, but the your doctor, while doing like routine vaccination, routine thing, they auscultated with the stethoscope and found out there is some extra sound or some murmury sound is there, and then they come to know. So whenever you come to know anything like that, it's you should go to a pediatric cardiologist. They are the well trained doctors, only pertaining, only seeing the pediatric cardiac heart diseases. Once you know, because some of these can be do without surgery, open heart surgery, just by the balloon inserted from the vein and opening the wall, and then the balloon was removed, and then the child can go in 1 or 2 days. Or some may require the open heart surgery. So for that, you need to be go to the pediatric cardiologist and the pediatric cardiac surgeon, so that we can give good life to the child. So this is the first thing. Now, this is in general the short for the congenital heart disease. Congenital heart disease means which is present from the birth and having the wall involvement. Now, the major chunk in the developing countries, I told, it's the acquired, means it developed afterwards. And the most common age is 5 to 15 years. So, any child with 5 to 15 years of age, the wall involvement is there. The most common cause is the rheumatic heart disease. Rheumatic heart disease is the, sorry, condition which start with the throat infection. So first, throat infection, as if I told throat infection, then you should not be worried, because not all throat infection will cause. Only 3 to 5% of the throat infection, which is very significant in cause because of bacteria, not viral, that may leads to the heart involvement in kids between 5 to 15 years, and then sometimes you will see after 25 to 30 years also. So when you will think whether high grade fever, your tonsils are enlarged, your throat is very congested, the white patches on the tonsil, these suggest you of bacterial causes, not viral. Viral causes usually cause watering, sneezing, and just mild throat congestion, loose motion. This is viral. So once it's not viral, you should see for the bacterial high grade fever, difficulty in swallowing the food, tonsil enlargement, redness of the throat, white patches on the throat. That is the bacterial. And once you treat this bacterial, you have to treat with good antibiotic. And if you treat with this good antibiotic, chance of rheumatic heart disease is less, because the rheumatic heart disease is caused by the same bacteria which is causing this. So that is known as streptococcus. So once group B streptococcus. Once you know this, there is a throat congestion that is bacterial. You have to treat very well with the medication. Viral you can avoid, but once these features are there and throat infection is unable to get controlled with the normal medicine, then probably you treat with the antibiotic, because once you treat with the antibiotic, chances of getting heart disease will be reduced by 20 to 30%. So this is the rheumatic heart disease, how it starts. So as a matter of fact, as a uh, knowledge, the what the parent should have, once it's, if you think it's a bacterial, your doctor is saying it's a bacterial pharyngitis, in between 5 to 15 years old, you should get the antibiotic treatment, while antibiotic treatment is not required in viral fevers. So this is there. So once you come to know this, so then you have to prepare the, then you have to be see the patient after 2 to 3 weeks or 4 weeks, or sometime 1 to 2 months it will take to develop the heart disease. So what heart disease will develop? The I told you, left side between upper and lower chamber of the heart, there is a leak that is known as the mitral regurgitation. That is the 90 to 100% of the baby with rheumatic heart disease will develop the mitral regurgitation. So once the mitral regurgitation is there, that means, and if you fall this with the congestion, and apart from that, if you find out the feature like prolonged fever, then your bone pain, bone swelling, or some jerky movement which is known as chorea, these are the features which is suggestive of rheumatic involvement and more involvement of the heart. So once you have fever, once you have the arthritis or polyarthralgia, means all multiple joints are involved, not smaller joint, major big joints are involved with the fever, with your rashes on the body, and with the involvement of the chest pain or breathing problem, that is suggestive of the rheumatic fever or rheumatic heart disease. So first, it develops a rheumatic fever like throat congestion, bone pain. Then there is a rashes or some nodules on the body. And once you see the echo, that's why once you develop like that, the throat congestion continue for 7 to 10 days, then definitely you have to take care with your cardiologist. And if it looks like bacteria, do some blood test and then go to your cardiologist, so that they will see there is no valve involvement. So once this like that, sometimes after that infection, within 2 weeks only valve involvement there, or sometimes even after 4 weeks there won't be any valve involvement, but usually developed after 2 to 4 weeks. So once you see the heart and the valve leak started, that is the diagnostic criteria for rheumatic fever, rheumatic heart disease. So in a country developing where the rheumatic fever is common, that is the endemic zone like in India, any throat congestion, whether history or present or not, if you see the echo, the left side of the wall, like mitral wall, is giving some leak. That means that is the criteria of serve for the rheumatic heart fever, rheumatic heart and the rheumatic fever. And once the rheumatic fever is there, there is a predilection of 40 to 50% rheumatic fever will develop into in endemic zone into heart problem with the leak. Sometimes this is leak. Sometimes you will not find out leak. Directly you find out the wall block. So there are so many adolescent girls are coming to at 13 years, 14 years, 20 years. In West, this is usually happen after 20, 25 years. But in Indian population, even between 5 to 15 years, the wall block will be there. That is also mitral stenosis. So once you have the mitral stenosis, you will develop the breathing problem. You are unable to sleep well in the night. There will be air hunger. There will be breathing problem, and there will be fast heartbeat, and the lungs pressure will be very high. So these are the things which will push you to do something for removing the block. So same, if the rheumatic heart block is there on the left side of the mitral, then you have to go with the balloon. Same like we did for the other congenital, we go with the balloon that is known as percutaneous balloon mitral valvotomy to open the valve. But if there is a leak is there significant, then the only option is there is a surgery. But before surgery, once the suppose somebody comes with the 10 years of age with the severe function dysfunction with the valve leak causing heart pumping to less and breathing problem, then first you have to take the bed rest, give oxygen, give some medication to the congestion and improve the heart, and then you have to heart contraction, and then you have to give some medicine to decrease the infection. So that is known as aspirin or steroids. So these are the things which will given by 2 to 4 weeks. So now once you get the rheumatic heart disease, it is present with the acute phase when immediately after infection, or once the infection is not there, it can present late with the rheumatic heart disease with the heart involvement only, but no fever. So once it present with the acute, you have to do the bed rest, give oxygen, admit for 2 to 4 days minimum, give good antibiotic, and then you give the heart pumping improvement, and then medication, and then to give some medication to suppress the infection, which is aspirin and the steroid. So this is the first. And once you give it for the 4 to 6 weeks, after that, if you have to again check if the leak is reduced, then it's okay. You have to follow every 1 month, 3 months, 6 months. If the leak is not reduced, then you have to do the surgery. So this is the first, when it present acutely. Second, once it present late without infection, or infection happened very previously and now present only with the heart. I told you, wall blockage. Once the wall blockage is there and there is no calcium deposit in the block, we can go with the leg vein, and then we can enter the wall and we can open with the balloon. So it has got very good result. But when it's a wall leak is there, then if it's even if it's no acute fever, but if it's a very significant and causing the symptoms, what I told you, palpitation, and the and then you have to go with the surgical. So now somebody asked, are there any non-surgical treatment available for heart wall disease in children? Very good question. There are two things. What I told, once is a congenital and the wall is blocked, then you can go without surgery. You can go by the vein, like an angiogram with the balloon, and then with that balloon you can open the wall. The same in the rheumatic heart disease also. When there is a severe mitral stenosis on the left side, you can go with the balloon and open with the wall. Open the wall. So once the wall is blocked, then there is a chances of non-surgical treatment like balloon dilatation. You go like this is the wall block, for example, you go with the balloon and open with the balloon, the wall will open. So that is known as non-surgical, that is known as balloon valvuloplasty. But once you have involvement of the multiple wall, that is not probable. And second thing, once there is a severe leak, then the balloon is not possible, then you have to go with the open heart surgery. Now somebody again asked, can children with heart wall disease a normal life? So it's a very good question. If it's a treatable, I told you, when it's a block and you do it the proper time, block congenital heart disease, then 70 to 80% child will have a normal life. Only 10 to 20% if develop some complication because of the balloon or leak, and after the surgery they may have the repeated, may or may not need surgery, but they have near normal life. Second thing, once the rheumatic heart disease, once you got the initial leak because of the infection, if you treat probably very aggressively, the so many of child may need the normal heart life, but you have to continue the antibiotic penicillin for every 21 days, because once the rheumatic fever, rheumatic heart disease is there, there's again the chance of recurrence, relapse, and poor responder. So for that you need to continue every 21 days. In the muscle there is an injection called benzathine penicillin that you have to give by 21 days everyone. So every 21 days if you give, the chances of that will be very less, and then that will reduce the 30 to 50% burden or risk of the rheumatic heart disease severity. Excuse me. Is one. So that is on a secondary profile axis. So once there is an acute problem, treat that and follow up. If the wall leak decrease, then it's a well and good, but you have to continue the antibiotic, that penicillin, for 10 years minimum, or 25 years, whichever is early. And once there is a heart failure, then you have to definitely continue for 10 to 15 years. And then if it's a severe leak, you have to do for surgery. That the surgery are of two types. One, there is a leak or significant block which is not able to done with the balloon. There are two types of the surgery. Once you do the wall repair, you open the heart and just repair the wall leak, so that it will be improved. But once there is a severe wall leakage and if the wall repair itself is not fruitful or it's not yielding good result, then you have to replace the wall. So once you replace the wall, then it's a lifelong issue. But still, there is a hope, even with the wall replacement, if you take the medicine properly and show properly, you can have the near normal life. So, but once you have the wall replacement, you have to take the medication like warfarin, because once you are putting the artificial, there's a risk of clot on the wall and the wall will stop and there is a sudden deterioration. For that, you need to take the warfarin tablet forever. So once you take that warfarin, and so you have to restrict some fluid also, some food also, like beans, chocolate, because that is interfering with the warfarin action. So there are four questions. Non-surgical treatment, I told. Can children without lead a normal life? Most of the congenital heart disease with the wall blockage and which will open with the balloon, they have near normal life. But some with did surgery after the 10 to 20%, they have need repeated surgery, but 70 to 80% may have near normal life. Once you the infected type, like rheumatic fever type, once you do the proper balloon, and if you are taking the good prophylaxis, we are taking 21 days injection properly and taking the warfarin and all medication properly, you are near normal life. But you have to be little cautious, because if you are not taking the, again wall blockage will be happen, wall leak will start, and again you have to go to the surgery. So this is the one thing. Even so, what are the other questions there? Can the heart wall, this is children. I told you the heart. Now this one thing is there. Now we told what are the things we can do. The surgery is a good. You have to go to the center where there are good heart wall repair surgery like KIMS, where you can do the surgical repair as well as the replacement of the wall. Now, when the heart wall disease, when it's there in a congenital, they, if it's neglected and going up to the very severe, it will cause death of the child. It may cause severe debility of the child, like that they are unable to walk, they are unable to go play with their kids. So that's why whenever any wall disease there, you have to follow up regularly to check all those things. So what are the, one more question, can a disease can be prevented? Very simple. Second thing, once you have the heart wall disease, the chances of getting infection over that is very high. So one of the very neglected part is the oral hygiene. So one of the most common cause in the literature, which is find out the infection of the wall, is comes from your mouth, and you have to do the daily brushing. So the good habit to the kids to have the daily brushing twice and keep their mouth hygiene good will prevent the mouth infection. And second thing, keep your oral hygiene good will prevent your pharyngitis also in the 5 to 15 years, that will prevent the rheumatic fever also. So there are some things which can be preventable, like to once the rheumatic fever, you cannot go reverse it, but to reverse the more side effect over the later, you take the injection 21 days, keep your oral hygiene good, and then you visit your cardiologist every 6 months to 1 year or whenever required to see is there is progression or improvement or is any deterioration, so that we need to go for the balloon or surgical treatment. So wall disease in general, I'll go one thing, it's a congenital, you present from the birth. They may be leak, again it may be of the block type or leak type. The block type you can open with the balloon, or if the leak type you have to repair with the surgery. Okay, so this has got good outcome if you are doing the good center, and if you do a proper follow up to 70 to 80% child may have near normal life. 10 to 20% may again need one or two surgeries later, or they have to go, but they can still have their routine life unintact. So that's why that's the message. Whenever wall disease, don't keep in your mind that all wall disease are bad, but some wall disease are bad. That the mostly wall disease you can be treatable, and it can be not but near curable. If you come to the infection like the rheumatic heart disease, this is very dreaded complication. It is mostly present in the low socioeconomic status, where the overcrowding is there, or in the countries like India, where it starts with the pharyngitis, like throat infection, bacterial throat infection. So once you treat your bacterial throat infection very well, the automatic chances of wall disease can be prevented. If it happened, then also you have to take the treatment what doctor suggest, aspirin, steroid. Whether it's present with heart failure, not failure, take aspirin for 4 to 6 weeks. That also decrease the risk of heart disease in involvement of valve in the future. Once the valve involvement happen, then you have to take whether it's a leak, one wall involved, two wall involved, three wall involved. If one wall involved and only block is there, you can open with the balloon like it present in the congenital heart section. Or when the leak is there, you have to do the repair, surgical repair. But once the repair or balloon anything is there, then you have to follow up lifelong, and you have to take the vaccine, not vaccine, even the benzathine penicillin injection 21 days, so that it will prevent again the severity, and it will prevent the recurrence of the heart wall disease in the future. So what is the other question? Long-term effect of heart wall disease. So we already told when it's a treated, even when the treated, sometime 10 to 20% will get complicated over the period. So you have to follow up once the heart wall sets in. Even after surgery, you need regular follow-up to see the complication or see the decrease or increase in the disease. So it has got the various significant effect. If it's not treated, it will cause death or recurrent cough, cold, heart failure. Child may not able to cope up with their peer, and all those problems can happen. Okay, so what is the most common diagnostic test? So with that is the echocardiography. That means the heart echo, heart USG of the heart is the most common diagnostic modality by which you can diagnose the any valve involvement. And once the valve involvement, I already told you whether it's a congenital, acquired, rheumatic, the pathway is different. And when the block, you can do with the balloon, or when the balloon is not possible, you have to do the open heart surgery. First, you want to repair. If not repairable, you have to replace the wall. Once you replace the wall, you have to take the blood thinner medicine for lifelong, and you take, and whether you replace or not repair or rheumatic heart disease, you take the 21 days injection lifelong or up to 35 years minimum. So these things you have to check. Once you replace the valve, that you have to do the follow. But even after that, you can do the near normal life if you take your routine checkup. You can take the warfarin, and you are able to do the and take the medicine properly. So I think all questions surgical heart wall. So I think heart wall issue, you have to take how to take care, take good hygiene, avoid unnecessary overcrowding. Secondly, take good oral hygiene, that is also one of the important figure. Once you get any murmur, any wall, you want to do in follow up with your cardiologist. Second thing, whatever medicine they prescribe, take that properly. And if it's a rheumatic heart disease because of the infection, that you have to take the 21 days injection compulsory. And that injection you can take anywhere as per the government, ICMR and WHO. That all government hospital have that facility to give injection 21 days. That is penicillin injection. Some people are allergic to penicillin, they can take erythromycin also oral for that. But that suvidha, that facilities available in all government hospital and all private hospital, you can take that injection. So once you have throat infection, rheumatic heart disease, because the burden of rheumatic heart is still, you won't under the 3 lakh kids are there, 30 lakh kids, and out of that 5 to 50,000 are adding still per year in India. So you can imagine the burden of the rheumatic heart disease. So we all can reduce the burden if we know when to treat the bacterial endocarditis, avoid overcrowding, keep oral hygiene, go do regular follow up, and then once you diagnose it, see whether it's a severe or mild. If the mild is still, you can follow up with the injection only 21 days, no medicine needed. But if it's severe, you do the surgery or balloon, and then even after that, you have to do the repair or replacement to take the injection lifelong. So we all has to take care of our wall. So two things: avoid infection and take a regular checkup, that is compulsory. So I think this is the in general what we can think about the wall. And even the wall problem, if you do the balloon or even if with the surgery or the repair or replacement, still they have good life if they follow properly and take medicine properly. So my request: take care of your wall, take care of your mouth hygiene, take care of your general hygiene, and if you have any wall problem, be in regular touch with the pediatric cardiologist or pediatric cardiac surgeon, so that you can plan your surgery or you plan your medication, and with that you can able to live a near normal life at present time. So thanks a lot and have a good day.